Here.
All right, thank you. You have quorum.
Ms. Snyder, before you go back and start again, I call on you. Sheriff Cronister, are you up and can we hear you? Sheriff Cronister? I think he's having some audio problems there. Okay. Ms. Snyder, you recognize?
Thank you, sir. Can you hear me okay?
Yes.
Okay, thank you. Chair, I believe we may have acted in haste at our last meeting, and I do understand the sense of urgency that our group may have due to the nature of its existence, but that doesn't mean we necessarily bypass some due process, and I believe we made the wrong decision at our last meeting. Since Monday, my phones have been ringing off the hook, and my email has been flooded by citizens from all over the county who are upset about the curfew. And I think instead of sending a strong message to the violators of the Safer at Home order, which was, I believe, our intent, it sent the wrong message to the majority of citizens who are abiding it. People believe it's redundant, it's confusing and unnecessary. And after serious thought and consideration, I agree with that. And since the Safer at Home order already accomplishes our intentions, I'd like to make a motion to reconsider our vote to enact a curfew for Hillsborough County.
Is there a second?
I second that motion. This is Mayor Rick Lott.
Okay, we have a motion by Ms. Snively, second by Mayor Lott. Is there any further discussion on the motion?
Looks like it's gonna rescind the curfew.
Let me see if there's anyone's hand here. I don't see any other hands up yet.
Working on it.
Let me, who?
Oh, my hand's up. Commissioner Murma, is Sheriff Coster on the line yet? I just wanted to make sure. I mean, this is an important discussion. I do think that all the members should be part of the discussion.
Is Sheriff Cronister on yet? I see his picture. Sheriff, can you hear me? I see him. He's on the web meeting, but we cannot hear from him.
Perhaps we can do a show of hands if he's not available for audio.
However, I'd also like to recommend that Sheriff Conister call in. I've had to do that because of a problem with the video and signaling and getting dropped. That might be helpful to him.
Mr. Brewer, can you contact the sheriff and ask him to call in on the phone?
Yes, I will reach out to him now.
Ms. Snively, can we, I almost said temporarily pass on the Commissioner Merwin knows what I mean. Can we hold off on this motion until we get the sheriff on? Because I think it's vitally important he's on the phone.
Thank you. I do agree that it's important. It is vital for him to be a part of this decision. So I'm happy to take a pause and until we can reach him and get him on the phone or on video conferencing so that he can participate in this. I appreciate that.
Okay, we're going to what we call temporarily pass the motion by Commissioner Snively, second by my Commissioner Snively, Mr. Snively, second by Mayor Lott. We'll come back when Sheriff Cronister is on the phone, either given we can hear him. We're going to move over to the overview of public health, economic recovery, and community engagement strategies by Mr. Merrill. Mr. Merrill, you recognize.
Yes, thank you, Mr. Chair. I just wanted to take a moment here to frame today's agenda. So I think today's agenda begins a turn towards some strategic initiatives and less emphasis on tactical actions. So it makes sense that, you know, so far actions have in response to the virus have been mostly tactical, just, you know, as they would be in defending against and repelling any invader. So for example, we started by canceling major community events to keep the virus out, followed that with orders implementing social distancing, and we then moved on to establish collection testing sites and standing up quarantine, isolation, and hospital surge facilities. But there comes a time when we have to shift focus more long-term, and that means agreeing on desired end game outcomes and by designing, implementing strategies to succeed in what we all want, which is regaining a way of life, but ensuring long-term mental, physical, and financial health for community and residents. So I think there are really three main strategies unfolding here. And and they're all being addressed today in one way or another. So first, there's a continued strategy to design public health outcomes to keep the virus at bay while eradicating its presence. This strategy is evolving as science learns more about the COVID virus itself and effective means of treatment prevention. So you'll hear today from our public health experts and advisors, but with an emphasis on presenting data that supports their advice for continued vigilance as we strive for normalcy. Second, a local economic recovery strategy that supports both the life needs of our residents and supports a long-term financial survival and prosperity for our business sector. So you'll hear later in the agenda from Craig Richard, who is the CEO of our Economic Development Corporation, which is the natural lead for this collaborative effort on behalf of the community. So Craig did not hesitate for a moment in taking on this challenge, and I appreciate him being here with us today. And finally, a public engagement strategy, which is important because first, we have to reach a clear understanding and be convinced as a community of the continuing risks of the virus. And more importantly, come to some sort of an agreement on a common set of beliefs and values and behaviors that are going to support success in all of the public health and economic recovery efforts. Why is this so important? Because primarily we're relying on individual responsibility as the cornerstone of our end game. So as a beginning step, you'll hear today from Robert Allen of HCP, who we've retained to conduct a rapid but statistically reliable survey of our community to help us understand better how to increase valuable testing in our community, which has been declining. And the survey also probes residents' attitudes and behaviors in relation to how they understand the virus and their willingness to be tested. So these survey results will be a valuable resource and source of information as well as in designing ongoing public engagement. So with that as an introduction, we can then, Mr. Chair, if you're ready, move on to Dr. Holt's public health update. Thank you.
Okay, thank you, Mr. Merrill. Let me see if Sheriff Cronister is back on. Sheriff Cronister, you on with us now? Sheriff Cronister?
He's working on it. He's working on it. He's actually looking, he needed the access code and the password to log in by phone. He has that information now. This is Commissioner Overman.
How do you know all this stuff, Commissioner Overman? Okay.
Because
let's move it to
his deputy sheriff actually texted me.
Let's move to the Department of Health update. Dr. Holt, you're recognized.
Thank you, Chair. I'm going to talk about the epidemiology that on a number of cases second because I'm going to do a joint presentation with the county, Mr. Kevin Wagner. So I would like to begin with update on long-term care facilities. As we've been talking about, we have a number of these facilities, both nursing homes and ALFs in our community. We've seen in every state a repeat of what I think I described as my worst nightmare, a nursing home in Seattle where there were 35 deaths. So this has been our top priority, protecting our most vulnerable, and especially in this congregate living. Just to recall, standard steps that are in place: there's no visitors, all staff are wearing masks, residents should be confined to the room. If the residents leave the room, they should wear a mask, and there are no gatherings such as activities or there are no cafeteria style meals are brought to the room. But we know that COVID has been very insidious and has invaded a number of both these facilities and even hospitals, with much more resources and efforts to keep this virus out. Just as a recall, we began proactively in partnership with the City of Tampa and Hillsborough County Fire Rescue. We did some first in-person visits to make sure that they had all the information they needed, and we're proceeding with these recommendations. The state has contracted with an ambulance service, and they've done statewide inspections. They give us information back on specific needs based on what they find. And we've developed or have had a strike team, if you will, to respond to any report of an infected resident or staff. This is done jointly between the Florida Department of Health and ACA, who actually regulate the facilities. So far, our observations, facilities are clearly doing all they can that we've inspected. Their staff and their certainly care a lot about the residents. We've provided PPE educations and assisting with the management and guidance of their residents. We are continuing to be very vigilant and work very closely with our long-term care facilities. With that, I'm going to move to epidemiology. I'm just going to make a few high-level takeaways that I've shared at each meeting, but Mr. Wagner will provide a much more detailed review of the data in a time over time in a graphic form. We have 873 cases as of this morning. This is notable because we only had 4 new cases that were reported, again, from the results that came back to the state yesterday. My staff are both thankful and amazed, but they keep reminding me that we could see more this afternoon. We are beginning to see the results of our testing, the results coming back closer to when they were collected, which is very promising. We're seeing more frequently, we're seeing the 5 to 7 day turnaround, and the particularly long waits are becoming unusual. Overall, we're seeing a plateau or a stabilizing of our numbers of positive lab tests that are coming back each day. I can certainly say from our perspective on the front line that we are always appreciate and have best to have more information. That's why I'm hoping and will continue to have more testing being done so we can follow our positivity rate and hopefully see that drop. Additionally, the best information we have is always the most recent. So I think the fact that the lab results are coming in sooner is very promising. We have 52 patients that are now hospitalized. That's a decrease from the report I had on Monday, which was 60. Similarly, we have 22 in the ICU. That was down from 27. The number on the ventilators is about the same. Lastly, we have had 18 deaths. I reviewed every one of these with Dr. Devers, the medical examiner. We did have 2 Hillsborough County residents that died out of our county, so she did not have those information. 2 of her deaths were non-county residents that actually died in the county. So we have had 18 deaths in this county. Dr. Devers and I both looked at all of these cases, and our takeaways to date, 100% of them, all of them had many chronic illnesses, not just one. Most presented to the hospital at the time that they sought medical care, and they were very sick well after symptoms began. Hopefully the messaging that has been done through this community will continue to have people seek medical care earlier and get testing sooner. None of the deaths were really preventable in the sense of what could have been done differently, but I do believe that the efforts to coordinate both discharge from the hospitals and linking our most critical patients that are risk for severe disease to the outpatient care with the help of USF is going to pay dividends. And as been noted, a recurring factor is that several of the cases, not surprising, were infected through close family members and friends. And I I'll close there and ask Mr. Wagner to now present his information.
Mr. Wagner, you recognized. Thank you, Dr. Hope.
Thank you, Mr. Chair and members of the EPG. Mr. Chair, can you see my presentation?
Yes, sir, I can.
Thank you, sir. Again, my name is Kevin Wagner, business analyst for the Department of Healthcare Services for Hillsborough County. And I'm going to provide linear data impact or analysis of the numbers that we're seeing. This is to augment what Dr. Holt has just outlined for you all. Since March 23rd, the Healthcare Services Department has continued to track the daily information provided regarding COVID-19 by the FDOH. We have always tracked the 5 p.m. daily update that is completed by FDOH at floridahealthcovid19.gov. And again, as Dr. Holt just said, this was the morning update. I always use the 5 p.m. update for the end of the day for the information presented. When we talk about the overall scheme, we have Florida and Hillsborough County are the slides that are going to be presented. For Florida, on 4/15, we had 22,519 positive counts of COVID-19, which is a 4% increase from the previous day on the far right-hand bar that we're looking at. On April 14th, it was 21,628. And you can see the trend going up over time. What Dr. Holt mentioned was that the term of testing has always been a key that you're going to see in all these slides. The graph indicates the dates the results of the test are received, not when they're done, but when they are received. There's been a lag in getting the testing results, which the labs are working to catch it up. But overall, for the state of Florida, on average, it's about 900 daily increase in positive COVID-19 counts, or about 8% daily. So that's Florida. When we go down to the county level for Hillsborough County, on April 15th at 5 p.m., there was 870 on the far right side, which was a 6% increase over the previous day of 819. But a 1% increase over 813. So I think when we look at the positive counts, it's when we receive the test results from the lab is key. When we see the going up, sometimes we have those large increases. It's because we get those batches of results. On average, Hillsborough County is about 7% daily increase, or about 35% or 35 daily increase from April 2nd to April 15th. But when we think about our numbers for the county of 870 or 873, as Dr. Holt just said, we are less than 5% of the total cases in the state. As we know, Miami-Dade and Broward are the largest at 51%, followed by Palm Beach. So again, we have 870, about 35 a day. But again, we are very small when we look at the state total from the previous slide. Looking at the detail, the bottom green line is the Hillsborough County per day. So we talk about 35, we talk about the different numbers, but you can see the number for Hillsborough County in the bottom green line has been pretty flat, essentially flat. If we look on April 12th, 13th, 14th, and 15th, we see some increases. Well, again, from the conversation with Dr. Holt, the labs are getting the results in. We're not having more positive cases, we're just getting the results in quicker. Again, the county's been flat, it's done a good job with the mitigation and surveillance, always the need for increased testing, but again, we are 35 or so a day. The blue line above that, that's Florida. And you can see the variability with getting the test results in, hence the need for more testing, hence the need to get those results in quicker than 14 days, get them to 5 to 7, get them quicker results. But again, for the county component, we've been essentially flat. I'll direct you to the far right side. So when we do testing, or when testing's done, there's always a negative and positive and inconclusive component. Right here is positive and negative. So the light blue, green, sea green color on April 15th, the results came in 93% were negative for Hillsborough County, 7% positive. The gray bar, Florida, was 89%, 11% positive. And you can see that throughout each day. Through the trend view, Hillsborough County has been tracking less than the positive counts for Florida. It's always been 6% for Hillsborough County, 10 or 11% positive for the state of Florida. But as my conversation with Dr. Holt this morning was, that 7 or 6% positive, we want to get that to decreasing down to none eventually. So again, testing will be key and surveillance and social distancing. The next slide, while this one looks quite busy, it is actually a quite easy slide. On the far right-hand side, right column, through April 15th at 5 p.m., there were 214,210 test results received in the system. The previous day was 206,000. So the delta of increased test results were 7,672. It's not saying that there was only 7,600 tests done that day, but that was the results that were received. On average, the state of Florida is receiving 10,600 test results daily, or about a 9% increase every day in the totals. But you can see that more testing has led to higher results. When we flip that to Hillsborough County, again, far right-hand side, there was 13,341 tests received. 12,702 was the previous day, 639 test results received. On average, that's what Hillsborough County is getting, slightly above 600 test results daily, or an 8% increase every day. Again, everything's been flat. The county and state of Florida have been tracking the same from positives that we previously saw on previous slides and through now the testing increases of 8 or 9% respectively. Now, when we talk about testing, I think it's very important to think about the ratios. How many people to test? On the far right-hand side, it shows Florida as 100. So what does that mean? Well, when we look at the beaver population, the state of Florida is 21.5 million people, give or take any 100,000. Divided by the number of tests completed that we saw 2 slides ago, 214,000, that means 100 people to 1 test. When we break that down even further, 100 people to 1 test means that we've only tested 1% of the population in the state of Florida currently. Lower is better on this ratio. More testing will lead to lower numbers. When it's 50 to 1, that means we have tested 2% of the population and things of that nature. Again, this chart is a lower is better, indicates more testing. Hillsborough County is 111 to 1. Because again, beaver was 1.4 million divided by the number of tests that have been received, leaves 111 people to 1. Again, we want to try and get that lower with more testing. Again, about 1% of the population in Hillsborough County and the state of Florida have been tested or received results testing. The last slide of my deck, this is one where I even had to pull back on when we start looking at data, is the death rates. Everyone is concerned about the death rates. Well, when we think about that, the death rate percentages that you see, it's only based upon the reported cases of COVID-19. Currently in Florida, on the far right-hand side, it's 2.73%, and the county 1.84%. But again, it's only based upon the reported cases of COVID that we have testing results on. Second, Hillsborough County's only had 18 people pass away. So any increases for us dramatically affect our percentages. As you can see on April 11th, we were at 1.29% and it jumped up to 2.11. There were, I believe, 2 people passed away or a number passed away. So again, we had the reported cases per death rate, and then we have such small percentage. The reason why we outline these slides is it's important to look at the data and to understand the context of what we're needing. The social distancing, the testing is key. We are matching the state of Florida in the sense of the number of positive count percentages and number of test results. And again, but on the death side, we have a much smaller number. Again, when we look at all the data and understanding what Dr. Holt's presenting in his observations, we have to understand the context of what we're trying to get to through all your mitigating actions. That's all I have. If you have any questions, sir.
Okay, thank you very much, Mr. Wagner. Before we get into questions, is Sheriff Conister back on with us yet? Sheriff
Yes,
Conister?
Mr. Chair, I am. I apologize.
Okay, all right, no problem. Let me ask a question of either Dr. Holt or Mr. Wagner, and maybe I don't know. We'll see who else can answer this. Last night I saw a report that said that even though Florida numbers were looking good, that Florida would not hit its peak into the increase in number of cases and number of deaths until the last week of April, first week of May. That report I saw last night, that our numbers may be looking good, and we maybe in some areas the death rate is not as high as we anticipated, but they also said that last week of April, first week of May could be when Florida hits its peak of more cases and more deaths. Can anyone comment on that, Dr. Holt or Mr. Wagner?
Yes, sir. I'll try. As we've talked about, when we started very early, the whole hope when with your leadership of the group was to implement social distancing to basically flatten the curves, take the peak out, and spread it out a little bit. So our slope is going up slower, but we will peak at least that's the estimates of these models. We're just going to peak at a lower height, if you will. So I see it as a very promising or encouraging evidence that the efforts that are being made by the community and everyone together is having an impact. I'll stop there.
So we're having an impact, even though we'll have more cases and more deaths from what I saw the latter part of this month, the first part of next month.
Yes, sir. We are increasing. It's just the slope of the curve. We talked about, people had lots of term, the doubling time, and how quickly the cases were compounding, if you will. And if every day was going up, then that creates a cumulative wave of secondary infections. So at least if you are seeing a relatively, not a drastic increase, but we are seeing a small percentage going up, then the end result, is that when we do flatten out, which is the time frame, or hit that top, which is what the predictions of the models, we will, be in better shape than if the worst had happened, if these increases were twice or three times what Kevin has outlined for you, which has been seen in other parts of the country and the world, often in a very compressed timeline, less than a few weeks or so. I'm not sure if I'm answering the question, or doing my best to try to explain this whole epidemiology and the flattening of the curve, if you will, sir. I'll stop.
Okay. Commissioner Merman, you recognize.
Thank you, Mr. Chair. I guess I have one question for Doug. I think the concern is the long-term care facilities And I know we're doing everything possible here, and I think that's why we have not had the deaths or the situation like over in Pinellas County. But if this went long term, I mean, I do get very concerned and care about, the patients in these long-term care facilities, because without visitors, without any socialization, that's going to have a severe impact negatively on their long-term health. So I guess, is anything being done or, across the state that we could implement here that could help us in that regard?
Yes, ma'am. The additional, as more and more PPEs come in, we're certainly providing as more and more of what we can. But the way I see this is that, we're going to have COVID-19, even if it's at low levels, on an ongoing basis. And so the vigilance of keeping a watch, if you will, or doing some of the standard precautions are going to be continued, but maybe not to the extreme as far as the visitations. There's been a lot of discussion about the coming advances in testing. So rapid testing available even on site could be of great value in testing for both the employees, maybe not the visitors, but certainly employees, because that's so far that is the most, sadly, the people who are caring and doing the most have been more the ones that have inadvertently brought this virus in. The antibody testing will be helpful long term as well. And so, I think we're in a phase right now where we don't have quite as many tools as we have that we're hoping to have literally in the next few weeks, or certainly within the month. And obviously long term, the true solution to this living with COVID is the vaccine. And the advantage of COVID over influenza, let's say, is while COVID mutates, it doesn't mutate so much that you have to make a new vaccine every year. At least that's the belief. So if we can get that vaccine and people are vaccinated, then we won't have COVID constantly looking over our shoulders, worried about that being with us. I'll stop there.
Okay, thank you. And I do want to thank Kevin and the healthcare services staff for that great report, and hope we can get that information weekly because, as you know, data should drive our decisions going forward. I think what he has put in there is very helpful and shows that what we're doing is working. Thank you.
Commissioner Overman, you recognize.
Thank you, Chair. Thank you, Dr. Holt, for your report, as well as Kevin. That was excellent. The important thing I think I heard is, we're still at a level of only testing 1% of our population. And of that, we have a 5 or 6 or 7% positive rate. And that is concerning because that means there's another 99% that do or do not know whether or not they've been exposed. And because of the level of this type of virus, in the sense that you can carry it for 5 to 7 days before you realize you're actually sick, having a lower number of testing doesn't give me a sense of comfort that we have any grasp on whether or not loosening the rules or suggesting anything that wouldn't strive to be most careful to avoid the spread of this virus is a paramount concern. I noticed that some of the testing numbers have fallen on a daily average, and I think I heard you say that it was because of the results getting back. But are we still on average doing 600 tests a day at the call centers, or are we seeing a drop off, or do we have enough kits? Can you share with me that information, please?
You asking that, Dr. Holt?
Yes.
I actually, Kevin, there was a presentation that you shared with me. I can speak to it, at least from the Raymond James. And what it indicates is that the numbers of weekly cases have actually gone increasing steadily for the first 2 weeks, but the actual numbers of those tests for this current fourth week, and we're not fully completed yet, you don't have all the data, is looking like it's trending downward. And our kits appear to be in adequate supply, at least from the numbers that I have. But these are data that was shared with me. I'm not the originator of the data. The other take home that was shared, again, which was not surprising, was that the results are about a week behind if you look at the ones that are pending versus those that have returned. So, so Commissioner, I think you are correct in that, at least from the Raymond James Center, this past week there has been a reduction, and in fact that's, I think, why we are working very much with both the healthcare community, healthcare systems, our FQHC partners, the health department, to complement or extend the Raymond James access to testing and decentralize it some more, get it out further and further, or closer and closer to the communities, which is something Mr. Early has taken the leadership on and is getting cooperation from the healthcare providers. I'll stop there.
Okay.
Thank you very much.
Thank you, Dr. Holt. Is any other presentation you have to make, Dr. Holt? Is there anything else you need today?
No, sir.
Okay. All right. Thank you very much. We're going to revert back to the beginning of the meeting. Sheriff Cronister was not on. There was a motion by Ms. Snively, seconded by Mayor Lott, and I'm going to ask Ms. Snively to repeat her motion. Ms. Snively? Can you hear me?
Oh, can you hear me now?
Yes.
Okay,
Can you hear me?
thank you. Yes, yes. So for the benefit of Sheriff Cronister, I had mentioned that the curfew, since the safer at home order already accomplishes the intentions, and I'd like to make a motion to reconsider our vote to enact that curfew for Hillsborough County
And
on the
it was a
basis of
second-
it. Yeah. So
And that was a second by Mayor Lott. And the motion is to rescind the vote, but it'll be back up for discussion. Is that understood?
as opposed to a reconsideration.
We're voting to reconsider the vote. That's what I
Yes.
thought. That's what you said.
Yes, yes, it is.
Okay, so we're reconsidering the vote. Then we'll be back on that particular item for discussion if we pass the reconsideration. I know everyone understands that.
So the intent of the reconsideration is to rescind the curfew. So it's actually revoting for.
So your motion is
revote.
your motion is to rescind the curfew.
If that
Is that
makes
your
it
motion?
clearer, yes.
Okay, all right. Before you said rescind the vote, but now you want to rescind the whole entire curfew. That's your
Yes,
motion.
yes, that is fine.
Okay. And Mayor Lott, you still seconding that?
My second was 100% to rescind the curfew.
Okay, all right. So the motion is to rescind the curfew by Ms. Snively, second by Mayor Lott. I hope we have some discussion. Does anyone want to discuss the motion? Anyone want to discuss the motion? Okay, I saw Overman's hand. Commissioner Merman, you recognize.
Thank you, Mr. Chair. And I will be supporting the motion that Snively has made, but I want to make these comments, especially to you, Commissioner Miller, because I know why you made that motion, because you care so deeply for our community, and you want our community, you want to get rid of this virus, and you want our community to get back on their feet. And you have so much compassion for your constituents. And I really believe you spoke from your heart. You actually even struggled because you know we have a problem. You didn't know exactly which way you wanted to go. But I heard your concerns. And yes, maybe we might have acted hastily, but I know that you will be very vigilant over the numbers, especially the health numbers that were presented today. If we need to adjust it going forward, you will bring it back to our attention and we'll act accordingly. But I feel that we got good information from our sheriff about the number of cases, complaints he has acted to. We have not gotten that same information from our police department. We have gotten great now health information. And I believe as we dig into the data, that data will drive our decisions. And I do believe you have such great concern for our community and your constituents. And I know you are acting appropriately on that. So I don't think anything was done wrong. I just think that looking at the data, maybe we'll kind of reserve any emotion like that for, a later date if it is needed. Thank you.
Well, thank you, Commissioner Merman. I'll say some remarks after Mayor. I appreciate your comments, Commissioner Merman, and you're absolutely right. Merman, and you have. But I'll say something after Mayor Lott. He's recognized. Mayor Lott, you recognize. Mayor Lott.
Thank you, Mr. Chairman. Yeah, the reason why I second the motion, I'm against the curfew in the first place, is all the reasons why Ms. Snively mentioned, but it had no reflection on your motion the other day. As you know, I all the respect and love for you. We've served many, many years together. This has nothing to do with you. It's just that from a citizen standpoint, it sends the wrong message. It is the wrong message. And I just don't think we should lead from fear amongst our citizens, but lead them through, encouraging and motivating them and making recommendations. And so I believe we can restore a lot of good faith and trust with our citizens by removing this cloud over them of a curfew and going about doing the good work that we're already doing. So, Mr. Chairman, have all the faith in the world in you 100%, but I will be voting in favor of this motion. Thank you.
Okay, thank you, Mayor Lott. Let me say this. First and foremost, Ms. Snively was on the prevailing side, so she can make this motion. And let me thank Commissioner Merman for what she said. I've been in this business a long time. When I leave here in November, it's my 24th year. And I can count votes. I learned to count votes very early my freshman year in the Florida legislature. And I can see the votes here to rescind the curfew. I want to make it known from you all and the people that are sent those 600 emails and even the ones that call me the N-word. I made that motion because the mere fact is that I'm trying to save lives in this county. Our numbers have not been what we've seen in New York or Detroit or Miami. And I think we should thank the Lord for that. But that does not mean that it will not happen. You know, we just heard that the latter part of this month and the first part of May, we're going to hit our high numbers. Either those being infected and getting in our hospitals, or those that are losing their lives, and even those that are walking around with this disease and don't even know that they have it. And what we were having is people gathering in corners and gathering on streets and gathering on basketball courts, more than 10. And we don't know what's happening with them. And that one person can spread that disease to hundreds and hundreds of people. And I just did not want to see that happen in our county. It was for some political reasons. People said that I did it for political reasons. I'm not running again. So it wasn't for any political reasons. It's because I wanted to make sure that Hillsborough County did not have the widespread of the COVID-19 coronavirus disease to anyone in our county, and our numbers start shooting up, and we become the epicenter of this disease. Did not want that to happen. So that's why I made that motion, and Commissioner Merman is right. That's why I made that motion, and you all passed it because you thought it was the right thing to do. But again, I can count the votes. But let me say this. We're going to rescind this curfew today, but to law enforcement, be it the sheriff's office, and I know Sheriff Cronus is doing what he's doing, but City of Tampa, Temple Terrace, and Plant City police officers, one of the things that the governor put in his last executive order was under Section 3C, a social gathering in a public space is not an essential activity. Local jurisdictions shall ensure that groups of people greater than 10 are not permitted to congregate. So when we do away with this curfew today, law enforcement, if you see that happening, you're going to educate first. You're going to go up to them and tell them what they're doing is wrong, that you can't congregate more than 10, and then ask them to leave. And if they don't, utilize the authority that was given to you under this executive order and arrest them. Because if you don't, those numbers that we're talking about are getting low, it's going to rise, and we're going to hit that peak. We're going to hit that peak, and we're going to have that we want that curve to go down. It's going to start doing this. That's all I was doing, was trying to save lives. I don't care what color you are. I don't care how much money you have, what sexual orientation you may have. And I've been called some dirty names since I did that. The most difficult one was being called the N-word and a Nazi. We have a motion by Commissioner Snobby.
Mr. Chair.
Yes, sir.
Mr. Chair.
Who is that?
This is Chad. So I don't know if I'm still having computer problems. I've been.
I can hear you, sir. You're recognized.
I appreciate it, Mr. Chair. And I agree with what everyone's saying. Your heart is always in the right place, and you've done more for this community than most could ever hope to do. And our hearts were in the right place as this group has extremely difficult task of making tough decisions that affect 1.4 million residents while being provided a fraction of the needed information. This group did move too fast and simply did not communicate well about limiting interactions during the overnight hours. While I voted for that curfew and will always err on the side of caution when it comes to protecting our community, after talking with all of our chiefs of police and studying the calls for service, the data clearly shows that we should not continue the curfew. The continued use of a curfew is not a tool that law enforcement needs, and continuing a curfew is redundant as our stay-at-home order already creates a 24-hour curfew with the same exceptions. It has confused the public at a time where we have already limited so much, and our policies are working. The vast majority of our citizens have proven in the last 30 days, Mr. Chair, that they want to help. They want to flatten the curve. They want to be a part of stopping the spread of this deadly disease. I believe we drove the message home that we are serious about people not congregating in groups more than 10. And if we encounter large gatherings where education and encouragement do not, we can target those individuals without making an order punitive for the remainder of our community who is following the established guidelines. I too am asking you to to rescind the curfew order established on Monday. And I would also suggest or make the recommendation that our office will provide the entire policy group with all the calls for service regarding large gatherings on a weekly basis, so we can continue to monitor to see if there is a true cause for restricting additional movement.
Thank you, Sheriff. Commissioner Overman, you recognize. Commissioner Overman, you recognize. Commissioner Overman, can you hear me?
Okay, hang on a minute.
Commissioner Overman, can anyone hear me?
I can hear you.
Yes, Yes, Chairman Miller, we hear you.
I'm asking for Commissioner Overman. I think I saw her hand. She's not responding.
Okay,
I
I'm
don't think
here.
Commissioner Overman can hear me. Okay.
I'm here. Okay, I apologize for the noise, but I wanted to say something. I think our thoughts in the last time putting a curfew together was with the right intent, but it did create some confusion. I think what's readily clear by what Commissioner Miller said is that it is imperative that our citizens follow the stay-at-home guidelines and understand the rule is, the distance is critical. The limit of 10 is critical. And with rights come the responsibility to not only yourself, but also everyone around you to not share this virus and kill your neighbors and friends. So I think the idea was a curfew because some people just did not understand how critically important it is for us to follow those rules to save our county and our jobs and our community. And while I'll support today's motion, I do understand how hard it is to help our people understand that with rights comes responsibility. And it is everyone's responsibility in Hillsborough County, as well as the state of Florida, to follow the guidelines to allow us to get back on track so that we can do the great work that we do here in Hillsborough County. Thank you.
Seeing no more hands, please call the roll on the motion by Ms. Snively, second by Mayor Lott.
Miller,
Yes.
Overman,
She raised her hand. Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried 8-0.
Thank you. Emergency management update, Mr. Dudley.
Good afternoon. Current EOC actions as of today. As of 9 a.m. today, Tuesday through Wednesday at the Raymond James collection site, we have 697 people tested. We had another 250 scheduled for today. We'll have a final count after our 4 o'clock update after our actions for today. I want to remind all our citizens, if you are interested in being tested, please contact us at 813-272-5900. Call center remains open Monday through Friday at 8 to 5. We are continuing to work expanding the collection from Raymond James. We've identified during Monday's meeting 3 community resource centers, Lee Davis, South Shore, and Plant City. We conducted site visits for each one of those sites yesterday, and today we will continue planning for those sites, working with our healthcare partners that's been assisting us out at Raymond James. And also, I'd like to thank USF, their medical team. They begun some training with our folks out at the Raymond James site so they can assist us at these 3 new sites that we'll be looking to stand up through next week. We continue to operate the quarantine and isolation sites. We have 4 guests in quarantine and 13 guests in the isolation. We continue to work with the state of Florida Emergency Management Center. They've asked us to take a look at all current mission requests as they are looking at mission requests to ensure that we have the most current needs fulfilled. We currently have 1,518 requests. The supply chain seems to be opening up for some more traditional cleaning supplies that we initially had trouble getting. So they're asking us to relook at those and handle those at the local level. So at the state level, we focus on critical PPE. We've distributed over 317,000 masks, over 28,000 face shields, over 6,200 gowns, goggles, over 3,000 goggles, and 138,500 pairs of gloves. And the state continues to push us PPE. We're expecting another delivery over the weekend or early sometime next week to continue to support our efforts here in Hillsborough County. We do continue to request from the public to make donations for medical supplies as well as homemade masks. And you can drop those off at 250 West Shore Plaza. That collection site is open at 9 a.m. to 3 p.m. and that's Monday through Friday. So any efforts are greatly appreciated. Some additional information to ensure our citizens can meet and have any unmet needs taken care of. Aging services, they have a grab and go meals. Due to closing of congregate dining centers and senior centers during this event, Hillsborough County provided meals at 26 locations, including 10 grab and go sites. You can take a look at, visit our hcflgov.net/stay safe to take advantage of that. Also, Hillsborough County Library staff, they're sewing masks for Hillsborough County Aging Services staff so that they'll be safe as they go out and delivering necessary supplies to the residents of senior housing as well. Also, Feeding Tampa Bay announced a weekly drive-through grocery distributions that are taking place on Saturdays through the end of April at Hillsborough County Community College and on the Dale Mabry campus. Again, please visit our hcflgov.net/stay safe site for any scheduling. And that concludes my updates. Any questions?
Thank you, Mr. Dudley. Commissioner Overman, you recognize. Commissioner Overman? She disappeared. Commissioner Overman, you recognize. Commissioner Overman, can you hear me?
I'm good. I'm sorry.
Did you have a question for Mr. Dudley? No? Shake your head, wave your hand. Okay. All right, we're going to move on to Dr. Donna Peterson, the dean, and Ms. Marissa Levine, the professor of the University of South Florida Public Health School of Public Health, and Dr. Thomas Unash of Global and Planetary Health Strategic Area Lead at USF. Dr. Peterson, you recognize.
Thank you, Mr. Chairman and the members of the EPG. I'm going to let Tom Unash update you on some of the things he mentioned on Monday, the syndromic surveillance system that we're ready to launch, and some of his other work. I will just preface these remarks by saying how much I appreciate what we've heard here today. The reports have been excellent, and I think they really speak to the importance of the efforts that you've already engaged in to try to reduce the transmission of this virus. The emphasis on testing is essential. The emphasis on maintaining the distancing between people is essential. And the emphasis on moving forward, as the commissioner said, we do need to begin a planning process now for how we will recover from this and restore some normal sense of operations and our livelihoods while we continue to work against the virus. The last piece being continued emphasis on identifying cases, contact tracing, quarantine, all keeping us as safe as possible until we have a vaccine and can develop herd immunity, which is the place we need to reach before we can go back to anything like a normal life. So with that, I will turn it over to Dr. Unash.
Dr. Nunash, you recognize.
Oh, thank you very much, Commissioner. Yes, I would just like to give an update on the syndromic surveillance network that we had talked about on Monday. I said it would be going live later in the week. Actually, the questionnaire is out there and it's live now. It went live on Tuesday night and then crashed on sometime on Wednesday morning, and we had to get back up again on Wednesday morning. I love computers. But it's up and running now, and I had several calls yesterday with the media, ABC, Telemundo, CBS, Tampa Bay Business Journal, a variety of other media organizations to try and get the word out on the website and ask people to start going there and starting to fill the survey out. We have a active link to the website now and what do they call them, a QR code, so people can point their cell phone at the little square box and it'll take them automatically to the survey to go ahead and fill that in. So any support and help we can get the word out on this survey by the county would certainly be most welcome, because the more people go in and log in and provide the information on the survey, the better the output and the stronger the predictions are going to be in terms of analysis in the Tampa Bay area. But I wanted people to know that it is indeed live and it's ready to go, and we're just hoping to get people to start to log in and start to provide the information that we can use to build this survey. Any other data? We've also contacted the people at in geosciences at USF, and we should be able to integrate other data into this if we can get data from call centers, from the county, or from local hospital systems about patients who are calling in with symptoms that are consistent with COVID-19, even if they don't have all of the symptoms that are consistent and therefore are told to go home and self-monitor and report back if they get worse. We can integrate those data into the system as well now and augment it to build an even stronger estimate of what's going on spatially in the county. We will have a call this afternoon to talk a little bit about a modeling project that we have going on, which also I think will be of use to the county to help the local hospital systems in the county make predictions moving forward onto the course of the epidemic overall in our county specific, in our Tampa Bay specific area, not just necessarily in the state as a whole, and also predict demands that are going to be there for hospital beds, for ICUs, and for ventilators across the 4-county area of the Tampa Bay region. So I'm hoping to be able to have that. That should be live again this afternoon, and we should be able to provide that as a resource for the Tampa Bay areas and the people who are making these important decisions moving forward, and very difficult decisions moving forward, I should say. I was also asked to provide some scientific literature backup on some of the assertions that were made on Monday, at the meeting on Monday. I've provided those in that have been included into the zip file that you folks should have all received before the meeting, talking about the effects of actually implementing mask usage and the relative effectiveness of homemade face coverings versus surgical masks. I've taken the liberty of going through those publications, and using a yellow highlighter to highlight the most important things so that you folks don't have to try and slog through all the difficult technical jargon that are in these papers, and you can look at the highlights and look at the data itself, which are highlighted in those publications. And with that, I think I'll turn it over and answer any questions if anybody has any questions.
Thank you, sir. I see Commissioner Merman has a question. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Dr. Yunesh and Dr. Peterson, I want to thank you both for really hanging in here with us and advising us and all the information. I do want to ask Dr. Yunesh, I'm hearing that, there's private provider testing going on. There's the testing sites where we have testing going on. And the information you're doing, will you be like the central depository of all the providers' information so that we can get just one set of data to make our decisions on? Is that what your intent is?
I don't have any intent here really, but if you're asking if we could do that, the answer is yes, we could.
Okay. And I'll tell the members of the APC, I really think this is something that we have to think very seriously for.
Commissioner Merman, for some reason, Commissioner Merman, you break it up for some reason.
Please lean into the microphone.
Okay. I think that can you hear me now?
Yes.
Yes.
Okay. I just think this is something we need to think seriously about going forward, because we want to make sure we have the most accurate information. And as I understand that the private providers are doing tests, they're getting results, and that may not be adding to the numbers of tests that we have and the results that we're getting. And that concerns me. Because as we're making decisions to help protect all of our members of our community, our 1.4 million people, and we're trying to help get rid of this virus and making sure we save lives. I feel like we've got to how long is it going to take you to get to the point where you can act as this repository and just start to get information?
We have a system that's set up now, and Geosciences has established a mapping system by zip code to collect testing results. So I think really the only issue that we have here, Commissioner, is getting some support behind us to actually have the people send us the data. And I think once we have the data, I think we can move forward to actually incorporate that data in and start developing these maps and data analysis in real time, because the structure is already all there. It's just a question of getting the people to send us the data that they've got.
And I'll just ask,
can you lean in again?
If I think I would just like to say, Dr. Holt, if we need to put the word out to everybody out there that's doing testing, every single person, and that let them know that you're the repository of data so that we can get this clear and true picture of data collection in our community. I think that's what the direction we should be headed.
Yes, ma'am. This is Dr. Holt. I just want to make sure that the state does get results from any test that is run. And actually, it doesn't matter where in the country it's run, if it was run and reported back to Florida. So that's the data we are getting. And I think very quickly we will have, as we already talked about, sort of that closure between the number of days it takes to get the results back. So that really does give us a pretty real-time information. So I think, the healthcare providers are doing great jobs at testing. We're seeing the results. So I don't know if I would want or expect them to report the number of tests they're doing from our standpoint, the state doesn't get that information, but the results, once you have the timeliness of their, I think it is maybe a lagging indicator or lagging by a couple of days or so, but it will be a very good indicator of how much testing is going on in the community. So I'll stop there.
Okay, as long as you feel comfortable with the timeliness of the information, because I keep hearing information that the private testers are getting their test back quicker than what we're doing. I think my desire is to get everybody on the same page, and the all test results come back at the same time, within the same time frame, and not have this disparity of reporting. So as long as you are staying on top of it and driving the information, I'll be fine with it.
Yes, ma'am.
Thank you.
Okay, Dr. Peterson, anything else? Dr. Nash, Dr. Levine?
If there are no other questions, there's nothing from me.
Commissioner Miller?
Okay.
Commissioner Miller?
Yes, sir. I'm sorry.
This is Andy
Sir.
Ross.
I'm sorry. Yes, sir. Yes, Mayor Ross. Yes, sir.
Thank you. I don't know if my raise your hand thing is. I had a question for Dr.
It was not, but go ahead.
Okay, should I proceed?
Go ahead. Yeah, speaking to the mic. You look down, we lose you.
Okay, thank you. I had a question.
Go ahead, sir.
I had a question for Dr. Unash. I wondered about this Friday or Monday when you explained the program, and now after looking at the draft of the data, I have a question. And so please see if my understanding of this is correct. It looks like the data that's presented by the Department of Health, the Dr. Holtz group, is based on the number of positive test results. And as he presented, the positive test results represent about 10% or less of all the tests that are conducted. So the vast majority of people who are tested are testing negative. And these are people who have gone through a triage process who have been approved for things. So they've exhibited some symptoms for somebody to approve them to be tested to begin with. My question for you, or maybe what I'm not understanding, is if your program to develop the geospatial hotspots and put this in GIS, if it's based on self-reporting on an internet survey, how do we assess the accuracy of that information? So if somebody feels like they have a headache or they feel like they may be sick and they go into your website and they indicate these things, how do you filter out what's truly COVID-19 versus what is not? Is there some mechanism in there to make sure that this information that's being charted and plotted is truly COVID-19, or could it be erroneous information because these people have not been tested?
Well, the issue here is that the amount of testing that's going on is actually pretty small within the communities. As you know, I think we're up to a maximum of about 1%, which was the data that we had just seen previously of the population in Florida has been tested so far. And yes, you're right about the people self-selecting going in. The program actually will allow us to provide a combination of different symptoms that are, characteristic of the COVID-19. So it's not relying on just one symptom or a small collection of symptoms. So they actually have to have a whole collection, a series of symptoms, and to actually show up on the thing. And the issue here is really that what we're trying to do here is maximize the sensitivity of the detection to try and identify potential hotspots for the city and the counties to actually look at, to go in and then investigate further, perhaps by going in and enhancing testing in those areas, or going in and looking at what's going on, particularly in those particular zip codes. So it's basically a first warning of things that may be going wrong, where in particular hotspots that will allow the city to go in and use the more specific measures of actually what's going on with COVID-19, which is actually, of course, going to involve the testing itself. So it will be a complement to the testing process. Right now, we don't really know where the problems are. And, where I'd like to describe this yesterday as right now we're in the middle of a wildfire, right? The fire is burning everywhere around us. And we can pretty much close our eyes and open up a fire hose and squirt it in any direction, and we're going to do some good to help put the fire in. But we're on the downslope, as you can see from the data that Dr. Holt has presented. And we're going to be reaching a point very soon where we're going to have starting to talk about what are we going to do when we think about opening back up again. One of the most important things to open when we open back up again is going to be identifying the areas where the embers still exist, right? Which are the places where there may be smoldering pockets of this that are occurring, where we're going to want to jump in and treat right away to stamp out that pocket before it can reignite the wildfire. And that's when this system is going to become particularly useful, because as an early warning system, it can give you a warning as to where there perhaps is a problem and allow you to go in and investigate that problem, test, contact trace, and isolate, which is going to be the key factors to maintaining the control on this epidemic as we start to reopen our economy and reopen our city.
Okay, but so I do have a better understanding. Thank you for that. I understand that much better. But if you mixed the actual test data and you put that into the system, into the same system with this somewhat unfiltered, wouldn't that skew the whole pot? Wouldn't those hotspots, wouldn't they would be looking like they were actually hotspots for the positive tests, but because they're mixed in with so much unconfirmed data, wouldn't that therefore be unreliable?
Well, I think the way to actually approach that, sir, is to not mix all the data together, but actually give the option for displaying the positive test results separately from the syndromic surveillance results. And then as we move forward, we can start to look to see how they correspond and see if the syndromic surveillance is really predictive of hotspots moving forward. So that's the way I think we should design it, is actually develop it as like 3 different maps where you could have hotspot syndromics alone, positive test results alone, and then everything put together in one.
Okay. That provided a lot of clarity for me. Thank you.
Thank you.
Okay. Commissioner Overman, you recognize.
Okay, we're going to try this one more time. Can you hear me?
Yes.
Yes.
Excellent. Okay. Thank you very much for your report. And Liana and your team, thank you so much for putting together the surveys. I'm curious about how they are going to work together, because I may have missed that. I had a little bit of a connection issue when you were doing your presentation, Liana. But the surveys, online surveys and the SMS surveys, do not appear to offer Dr. Unash's link for giving us ongoing information for those that may have, for example, come in contact with someone who has the disease or someone who's ill in their household. We asked some similar questions with the online survey information provided to us in the email that the county has put together with Robert Allen's team, which gives us a good information on what do our citizens know about this disease. But can we combine that with Dr. Unash's tool for doing the surveillance too? And I'll stop there.
May I comment? That's exactly what I'm hoping we'll be able to do. And I had spoken to the people in the geosciences department, and they're willing to step in and help combine all of this together. So the answer is, I think, yes, we should be able to actually combine as much of the data from the differing sources as we can. And the more data we have to augment this system, the better it's going to actually perform, I believe. So I would very much like to establish a contact with the results from the county system. Baycare has a questionnaire as well. And anyone who is willing to feed data into this, I have the mechanism already in place that we can basically combine it all together into maps that could be used for by the county and the health systems here to figure out what's going on.
Okay.
I can
I
see
see
that
no
working
more.
very well. Sorry.
My hand's up. Sorry.
Commissioner Murphy, recognized.
Thanks. This is quick. So, Dr. Unish, all the people that are going through screenings, but if they don't meet all the criteria, they're said to go home and isolate. Is there any way to track that data? Is that what you just described to us, how you would do it? I couldn't get clarity from what you just said.
Yes, indeed. That's what I would hope we'd be able to collect off of these questionnaires and, you know, the screening questions that people are asking.
Okay.
If we could pull that data in from the systems now, we can combine that into the syndromic surveillance network and actually add it in. You know, I'm concerned about people like who go in and they'll answer, yes, I'm have a dry cough. Yes, I'm running a fever, but my fever is 100 degrees. Well, you don't make the 101 cut off. Thank you very much. Go back home, self-isolate, and if you get worse, call back. You know, then they don't actually end up in the testing system because, well, they didn't meet that one requirement. But with the syndromic system, we could enter that data and have that data in there as well.
Yeah, because it'd be helpful to see the number of screening, not just the number of tests. So
yes, absolutely.
I agree. Okay, thank you.
Okay, thank you. I don't see any other hands up. So Dr. Peterson, Dr. Unash, thank you very much. We appreciate it very much.
We appreciate you. Thank you.
Okay, we're going to move on to community survey of attitudes concerning COVID testing. Ms. Liana Lopez, Chief Communication Administrator, Mr. Robert Allen, Vice President of HCP Associates. Ms. Lopez, you're recognized.
Good afternoon. As Commissioner said, my name is Liana Lopez, and I serve as the Chief Communications Administrator for Hillsborough County. Thank you, members of the EPG, for allowing us to present today regarding the upcoming community engagement survey related to the attitudes concerning testing of COVID-19. As we continue our strategic communications efforts through the Joint Information Center and push out vital messaging to our residents during the mitigation of COVID-19, we felt it critically important to begin to seek to understand the attitudes of our residents surrounding the pandemic, and more particularly, attitudes surrounding community testing. HCP Associates, a leading consulting firm headquartered in Tampa, specializes in community engagement research and a partner in community survey efforts with Hillsborough County, has begun work to assist the county with this research project. Working with the county's analytics and insights analysts, the team has developed a comprehensive survey that will provide useful information as we continue mitigation efforts. This survey allows us to develop data-driven strategies to continue to provide targeted information and resources to our community as we move forward. Joining me today and here to present additional information on this particular project is Robert Allen, Vice President at HCP. Robert, you have the floor.
Thank you, Liana. Can you hear me?
Yes, sir.
Thank you, Mr. Chair, members of the EPG. My name is Robert Allen, Vice President at HCP Associates. I am here today to speak to the multi-channel outreach regarding COVID-19 testing access. The focus of our initiative is to gain insights from the community during the crisis. As we begin, we are pushing forward with a multi-channel survey approach. The first is a telephonic survey. The second, a text message-based survey, which many of you have already seen. And the third is an online survey. These surveys are nearly complete, and the data collection process will begin as soon as tomorrow morning. We will be providing updates to the county on a weekly basis. Two of these surveys, the SMS survey and the online survey, actually provide real-time data to the county through their online analysis platform. The telephonic survey will be updated weekly after the first full week of data collection is completed. Through all of these results, Hillsborough County will be implementing its communication channels to make this survey far and wide available for both the online and the SMS survey. And as one final point, we have been working with Dr. Unash's team and are happy to provide that data to him. Thank you.
Okay, thank you. Ms. Lopez, is there anything else you need to bring forth?
I do not have anything else to bring forth.
Okay, and I see no questions. Thank you very much. We're now going to move on to presentation by Tampa Bay EDC from my great fraternity brother of Kappa Alpha Psi fraternity, Brother Greg Richards.
Thank you,
Throw that in there,
Commissioner.
folks. I'm sorry, I had to throw that in there.
That's all right. Thank you, Mr. Chair. First, let me start off by thanking all of you. A deep, heartfelt thank you for your leadership during this time. What's mostly appreciated about your leadership is that it comes from a position of care and thoughtfulness. So that's much appreciated, and I wanted to share that sentiment with you. So let me see if I can get my screen up here so I could share this presentation that's playing with you. Does everybody see that?
Yes.
Can everyone see that? Good.
Yes.
Yes. Okay.
Well, then that's a plus. Technology is working for me. Let me start off by saying that this recovery task force that both the county and the city asked us to head up is something that's very timely right now. And we envision not your typical strategic planning process that would hire a consultant and then go through hundreds of town hall meetings to ultimately develop, a plan that would sit on the shelf for another, 6 months to a year. We wanted to rapidly deploy some quick strategies that could be used as a guidepost, if you will, by both Hillsborough County and the city of Tampa to do three things: reemploy, retrain our dislocated workers, retain and support our local businesses, and then finally, we need recovery strategies and programs for both the short and longer term. So those are essentially the three key objectives that the task force is charged with. The role of the Economic Development Corporation is essentially to lead by convening some of our key industry sector leaders, our business leaders, our public sector leaders, as well as academic and association leaders to determine specific recovery recommendations. Our role is also to help coordinate these meetings and deliverables, and then ultimately communicate these recommendations to both the county and our city partners. Initially, the composition of this task force and the working groups will consist of economic development staff, county and city economic development staff, working in tandem, I might add, with our partners at this county and city, as well as Career Source Tampa Bay. We envision bringing in industry sector leaders from hospitality, like Visit Tampa Bay, Santiago Carrata, finance, IT, information technology, as well as academic leaders from our academic institutions, association and nonprofit leaders, from the chambers to community foundation to a number of other nonprofit sectors that could help in this effort. Not to mention our small business assistance leaders like the Small Business Development Corporation and other relevant service providers such as lenders and technology providers. We envision 3 working groups. The first working group would be focused on the reemployment and retraining. Of course, that's logically led by Career Source Tampa Bay and John Flanagan, and HCC, our partners over at Hillsborough Community College, Ken Atwater. They will primarily be tasked with identifying the training needs for the current occupations that's in demand, and also taking an inventory of the types of positions that have been lost during this crisis, and then matching those skill needs with where the demands are occurring for hiring. Of course, they'll be charged with identifying the delivery agents for these training programs as well. The second piece, or the second working group, would include retaining and supporting our businesses. Of course, this will be led by us, the EDC, as well as the Chamber, the Tampa Bay Chamber, and Visit Tampa Bay. Ideally, what we want to do in this group is there's already a number of federal and state local resources that have come online. Some have been depleted already. But the idea is to identify these programs and then ultimately promote what's available and then identify where some of these gaps are, which leads us to that last bullet point. There's identification of the capital needs for our local businesses. The third working group would include, which would be led by the county and economic development staff, would essentially include strategies and programs that can allocate the federal and state funds that are geared towards accelerating our economic recovery. There's a number of federal stimulus dollars that will be hitting the county and the city. And we would want to make sure that these dollars are being allocated in a way that can expedite the recovery. And so with the county and city economic development staff kind of developing the guidelines for how, or developing an outline of how these allocations should occur, I think that would be very strategic in this recovery process. Also, similar to other recessionary times when there were infrastructure projects that were developed to help expedite the recovery, this would be an important time to identify any types of infrastructure projects, whether it's communications, sewer, transportation issues that, that we can emphasize during this recovery process. Let me talk a little bit about what the task force is not responsible for. The task force would not be responsible for creating and implementing public policy. That's the job of our elected officials. And our job would be simply to provide recommendations so that we can create a sustainable way to administer some of these programmatic dollars that are coming around. Helping to identify which federal and state and local funds, loans, incentives, or financial incentives. We're not responsible for collecting these or administrating or distributing them. Essentially, our job is just to provide recommendations. The timeline for this program would be an estimated 30-day engagement. Again, you know, it's not the intent to create a long, lengthy strategic planning process, but to start developing things that are programs and strategies that we can quickly get our arms around and quickly start making a difference for our business community. Phase one would include where we are right now, which is drafting the framework for what this recovery plan would look like. The second phase would be convening these working groups that we just talked about, and then making those recommendations for program and budget needs. Phase three would be vetting these types of programs and refining the plan and making sure that we have the essential input for viable credibility for such a plan. And then lastly, you know, it doesn't do anybody any good to have a plan and not communicate it. So we need to develop a communication plan and then, of course, get about the business of implementing and executing this plan. We envision that the program measurables and outcomes are essentially the programmatic activity and utilization. As everyone has said before, you know, we're in uncharted territories, and so there is no baseline for where we are. It's important that we start looking at and identifying what local economic indicators we can use in order to identify if we're heading in the right direction. Things like unemployment rate, net jobs created, sales tax receipts, these are all indicators that can essentially show whether or not we're headed in the right direction. But because these programs haven't been developed, you know, it's important that we track the development of these, track the utilization of them. And those would be the key measurables and outcomes from this such plan. And again, as I mentioned before, the key deliverable is setting the recommendations, providing a set of recommendations that will be delivered to the county and the city for the purpose of assisting and guiding public policy and programs designed to accelerate the economic recovery. So with that, I just want to say again, the objective here is restarting our local economy. And in doing so, this is going to require a delicate balance between the needs of businesses as well as the health and safety of our workers. And I want to thank you all again for allowing the EDC to participate in this and lead it. And we look forward to working with you. Thank you.
Mr. Richard, thank you very much. We could not have gotten the right person to do this. I've had the opportunity to work with you very closely over the time that you've been here, and found that you are an excellent person in dealing with the economic development and dedicated to what you do. So again, thank you very much. You put together a plan there very swiftly, and I know you will make it work with the help of those that you're pointing on that task force. I don't see any hands right now for any questions. I get out. Yes.
Commissioner, this is Andy Roth. I'm sorry, I don't think your raise your hand is working.
Your raising your hand is not working for you, but go ahead. You recognize.
Thank you, Commissioner. I have a question for Mr. Craig. Very good presentation. Thank you so much for your work. My question is that all throughout your presentation refers specifically to Hillsborough County and the city of Tampa. Do the other two cities have a role in this endeavor?
Mr. Richard? Mr. Richard? I think we may have lost him.
Okay.
I see his microphone blinking, but I don't see him now.
I think, is that it?
There he goes.
Okay,
Yeah.
good. I'm unmuting it, and then I think someone else is muting it for me, so sorry about that. But yes, the intent is to get a diverse set of businesses and stakeholders involved in these working groups to get as much input as possible during this whole process. So while the city of Tampa and Hillsborough County is explicitly said, written on there, the cities of Temple Terrace and Plant City is expected to provide input during this process as well. So thank you for that.
Chairman, I have questions.
Pardon me?
I have some questions as Mayor Castor.
Okay, maybe the hand signal is not working today. Come on,
It does not work. Andy, don't feel bad. It does not work. Maybe everybody can just raise their hand.
Yeah, Mayor Castor, recognize.
Craig, thank you so much for that presentation and clearly much needed service and initiative here. I got a couple of questions. One is an overarching timeline that you're looking at, and
Yes.
two, what data are we going to work off of? Have you thought about maybe getting the Tampa Bay Partnership to do an analysis to begin today analyzing the businesses that have been affected? Small businesses are the backbone of our community, and ensuring that we have the correct data, those ones that have been most deeply affected, where we feel we'll need the job training, as opposed to just bringing people back to work,
Right.
or we go in different directions for some of those businesses. And so I think it would be great to have, when you get this incredible group together, to already have some data that will actually provide direction.
Mayor, I think you might have been reading my playbook, but that's exactly what the game plan was to provide data prior to the convening of all of our working groups so that they can understand the current situation. We want them to make decisions based from credible information and data. And so each one of these groups will be responsible for reviewing this type of data and taking advantage of it and making these types of decisions. But yes, the Tampa Bay Partnership has proactively been involved in providing research information as it compares our region to other regions And also, we have a number of our own data sources and data professionals that will be providing information to us as well as our academic institutions. In terms of the timeline, it's a 30-day timeline. Our goal is to quickly convene these working groups next week and the following week, get this information, we'll compile it, synthesize it, and then provide a plan to communicate all of this to the respective governmental bodies as well as the community.
Okay. Mayor, your hand device is working. It's just delayed. Ms. Snively, you recognize.
Thank you, Chair. And thank you, Mr. Richard, for your presentation today. It's very hopeful that we can get our businesses back on track when things get back to normal. I think as everyone might be curious to see how the plan progresses and for transparency purposes for the public, I know you mentioned that you'll be sharing your plan out publicly and to the different entities that are participating and that it affects. Will you be, if these EPG calls continue to occur and your plan is put into a format that you could share it with us, will you be coming back to these EPG meetings? And this is I think a great platform for presenting information to the public in addition to our group. And so I'd wonder if you would come back as your plan progresses, or when you have got a good framework put together, will you come back and share that with us?
I'd be more than happy to come back and share it with you. I'll be working with both the county and city staff, and anytime we think it's necessary or you think it's necessary for us to come back and provide an update or status report on where we are, happy to do that.
Thank you very much.
Thank you.
Commissioner Overman, you recognize.
Thank you, Chair. Can you hear me?
Yes.
Okay, great. Thank you. Mr. Richards, thank you very much for your presentation, and I'm excited about this workforce. I think it's important for us to recognize not only the workforce as well as our business owners in their struggles. I'm hoping that CareerSource may be able to give us good information on the number of people that have applied for unemployment and their respective industries and or employers, because so many of our businesses are teeny tiny businesses that don't necessarily navigate with the EDC in general, because we typically work with much larger corporations or businesses with the EDC. But I think it's important we recognize so many of our businesses are little mom and pops, and they've laid off their employees, and we need to have good surveillance on what those industries that have been most greatly impacted. Mm-hmm. The community development centers, like the one up at University area, CDC with Sarah Combs and Liz Gutierrez with the Enterprise of Latinas, can also give us some really good surveillance. Are these the types of folks that will be on your workforce? Question, and I'll stop there.
You raised an excellent point. Our hope is that we can cast a very broad net to get this type of input and feedback. But small businesses are the lifeline of this community. So it's important that we get good intel from the small business community to make sure that we're developing the types of recommendations that's going to benefit them. So excellent point. Thank you for that.
Commissioner Merman, you recognize. We can't hear you, Commissioner Merman. Commissioner Merman, your microphone is muted. Now, just muted again. Go ahead, Commissioner Merman.
Okay. Thank you, Mr. Chair, and thank you, Craig, for this important information. Yesterday at our board meeting, when we had the CareerSource, he did tell us where the mainly all the unemployment claims are coming from. He gave us the sectors. So it should be in your packet of information, Commissioner Overman. Also, I just want to make sure that the port and the airport are being considered as really important sectors. I know that generally the port they're going to start to see a decline in their container business because the businesses are not open right now. And also, they've already, of course, experienced a decline in the cruise. That, of course, the trade, small business, but also our agriculture, our farm bureau, ag is going to get hit pretty hard. They are getting their goods to the grocery stores, but there's just a lot. We're just such a diverse community. And I think we're just poised to act and not react in moving this forward. But it's a great plan. And however much money you need, I'll be behind it.
Thank you.
Well, I thought you said you were going to give it to him.
Oh, I could say that too, but it takes 6 more votes.
Out of your own pocket. Ms. Snively, you recognize.
Oh, I'm sorry. I thought I put my hand back down. I apologize.
Okay, all right. Mayor Castro, do you want to be recognized? Okay, your hand was up. Okay, all right. Greg Richards, great member of Kappa Alpha Psi. Thank you very much, sir.
Thank you.
We now move to our county attorney items. Ms. Beck, county attorney.
Good afternoon, EPG board members. Christine Beck, county attorney. I wanted to provide this board with information related to public comments at these virtual meetings. For some time, Mr. Merrill, his staff, and my office have been discussing the technology capabilities related to accommodating verbal as opposed to written public comments in a virtual meeting. Written comments have been shared already. Florida statutes require that members of the public be given a reasonable opportunity to be heard on a proposition before a board, unless, and there is an exception provided for actions that are being taken to deal with an emergency situation affecting the public health when compliance would cause unreasonable delay. And clearly we are in an emergency situation involving the public health. As Hillsborough County government has transitioned to virtual meetings, an enormous effort has been put forth by staff to develop the technology to both allow a virtual meeting and to accommodate verbal or phone-in public comments. As a result of that diligence and effort at the Hillsborough County BOCC meeting yesterday, a system was successfully utilized for the first time to accommodate phone-in public comments. So if this technology can be utilized at these EPG meetings, I would recommend it, and I will defer to Mr. Merrill to inform when that can begin. Procedures can be established to determine the amount of time to be allowed for phone-in comments and any other procedures you would need. And I will stop there and be open to questions.
Okay, thank you, Ms. Beck. I had a conversation with Ms. Beck this morning about this, if we can get this to work, and talked about the procedures. I think she can put together procedures, and also talked about the length of time that we would have for public comment. We encourage that most of the comments will be written, but we have to open it up for those who want to phone in, like we did county commission meeting yesterday. And my suggestion was that we set aside a 20-minute time limit and give each person 2 minutes to speak. At least that will give us 10 people that can speak. If they have 10 people sign up, I don't know how many would sign up, but to have it at least 20 minutes and give each person 2 minutes to speak on the issues that be coming before us. So that was my suggestion. If there are any other suggestions out there, please let it be known now so we can put this in place so we can start working on one for our next meeting. Any other suggestions? Okay, Mr. Merrill? Mr. Merrill?
Yeah, I think based on the success we had at yesterday's county commission meeting, I'll double check with my folks, but I'm sure we could be ready next week.
Okay. And is there any objection to setting aside a 20-minute time limit to have those speak and give them 2 minutes apiece? I see no objection to that. Okay. All right. Ms. Beck, is there anything you want to discuss on that again?
No, sir.
Okay. Any other items you need to bring forth now?
If you want to move on to the next one, the routine matter of extending the emergency order for another 7 days.
Yes, so we got to move on to that. Yes, go ahead.
It's a routine order that we have to do by law every 7 days, so it would be appropriate at this time to entertain a motion to approve the order extending it for an additional 7 days.
Okay, is there a motion?
I'll move approval.
Motion by Commissioner Merman, second by Commissioner Overman to extend the order for another 7 days. Is there any discussion? Ms. Snively, you recognize?
Thank you. I just want to be certain that the order that we are voting on now does not include an amended version with the curfew in it, and that section of the order, if it was an amendment, is removed from the original order.
It would be removed. I'm not an attorney. Ms. Beck, you want to comment on that?
Yes, Ms. Snively, we will ensure that that is not carried forward as it was rescinded.
Thank you so much.
Okay, I see no other hands. Please call the roll.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Watt,
Yes.
Snively.
Yes.
Motion carried 8-0.
Okay, thank you. Anything else, Ms. Beck?
No, sir.
Okay. We'll now move on to EPT discussions. Are there any issues we need to bring forth today in the discussion? Ms. Snively, I see your hand.
Thank you. I just wanted to, I probably could have brought this up when Ms. Beck was talking about procedural issues during our meeting. It may have been more relevant, but I wanted to talk to the group a little bit about how we've been making some of our decisions with transparency and accountability to the public. So, we've been meeting regularly about twice a week to address issues. And on Monday, we were, you had brought up the curfew issue, which we obviously did not have on the agenda. We had talked about it previously, but it had not been on the agenda and not really had anything written to review before we voted on it. And then another motion actually came forward where we were asked to wear face masks in public, again, with not really any notice and without the item being placed on the agenda. So I think it's created a little bit of confusion, and maybe some frustration in the public, and maybe some unfairness that we're not giving more public notice and for due processing some of these items. So for the record, I think that we should probably, if items are going to come to us for a vote, I respectfully request that perhaps they are brought up on one meeting, because we meet pretty frequently, that they are brought up in one meeting, and then like we did on Monday, move that item to the subsequent meeting so that there is a few days in between and some time for us to, as group members, collect data and information and be able to analyze it and have a thoughtful conversation around it, like I'm sure we will today, so that we are more prepared for that vote and so that we can listen to our constituents and have some public feedback through an item before we vote. So I don't know if that's something that we actually need to vote on as a process for our meetings, but I certainly think that procedurally it would make more sense and it would be more fair to the public and to the group members to have more time to review voting items before we actually take a vote. So for example, just like we did on Monday, not voting on the masks Monday, but putting it on the agenda for Thursday, and then subsequently doing the same thing for anything else that we need to vote on. Thank you.
Okay, Ms. Snively, I understand your point. Let me ask this question. Is there any objection to the thought process of Ms. Snively just put forth, or do we want to take a vote? I don't see anyone objecting to what we just said, Ms. Snively. So without objection, that will be our process from now on.
Thank you. I appreciate you all considering that. Thank you.
Okay. Mayor Casper, you recognize.
Thank you. And I agree. Thank you for bringing that up, Ms. Snively. And the one thing, though, a caveat to that is that there may be instances, emergency or exigent circumstances. But I do agree that, because we voted and then afterwards what we voted on came out and it wasn't what I feel we voted on, the actual document. So I agree there. And with that, I do want to talk about the face coverings and an order hopefully passed by the EPG for that. We have drafted and it was sent out to each of you. I hope you had a moment to review it. It is very, very simple. In essence, the face cover would just be a uniform piece of material that securely covers a person's nose and mouth. And the guidelines for that, there's an example on there of the CDC guidelines on the face coverings. And then also the simple standards of when they would be worn would be anyone that is working or visiting in a grocery store, restaurant, pharmacy, public transit vehicles, vehicles for hire, or other locations where you're not able to sustain the physical distancing from others. So very, very simple for everyone to understand. And just in those places where individuals tend to congregate and where we have seen the need for it. And there's also under Section 3, the exceptions, and that's for small children. If covering your face would cause an impairment due to a existing health condition, individuals who work in a profession that doesn't require face-to-face interactions, if you're exercising or working out, if it would somehow impede your profession. So very exceptions to that as well that would be very easily understood by the entire community. And as we heard from the doctors that were on today from USF Health, as we heard from them on Monday, talked about Austria and how that country had very, very few numbers of COVID-19 positive cases. And they attributed that in part to the adherence to wearing face coverings when in close proximity to others. They also said that the wearing of a homemade mask, even made of a t-shirt, could reduce the transmission of the virus by up to or over 50%. The CDC recommends people wear face coverings when in public. And when in public, the two easiest ways to avoid the transmission or contraction of COVID-19 is physical distancing or the covering of the face. And the face coverings aren't just a way to flatten the curve, they're a way to get in front of the curve and allow our community to open up more quickly on the economic front. And we would also be protecting the essential workers in each of our organizations collectively, but also those individuals that are working in grocery stores, pharmacies, restaurants, and a myriad of other essential service providers who oftentimes don't have a choice of being put in harm's way. They're putting themselves at risk to serve us. And so think of the cashier that tested positive in Sun City, or the Hart bus driver, and those are just a couple of examples. We certainly could bring up many more individuals that really didn't have a choice. And we owe it to those frontline workers to provide them with as much protection as we possibly can. Many companies will provide the face coverings if their employees request them, and all of them will provide the face coverings if there is an order. And 25% of the state's population is now covered by an order to wear face coverings. So the physical distancing and simple sanitation steps have had a very positive impact on the reduction of cases and the loss of lives, as had the stay-at-home order. And this is just one more step that we can take to help those essential workers that I mentioned before, working in the grocery stores and the pharmacies, takeout hardware. And we owe it to all of our essential workers and our citizens to take this simple step to flatten the curve and ultimately to save lives. And also, this is going to be a integral part of reopening our community and helping our small businesses get back up on their feet. So the wearing of the face covering is something that, in my personal opinion, it's going to become a way of life for us now and in the future. So there is no doubt that by putting this order in place, very simple, that we would be able to reduce the number of positive cases and also save lives ultimately. So I move that that we vote to put a face covering order in place, the one that the draft that was proposed, or if there are any additions or any discussion that anyone has, but that is my motion.
Is there a second? Commissioner Overman seconds the motion. Now we're going to go into discussion. We have hands up that I think there were for further discussion in groups. So if you want to address the motion that's on the floor, let me see you raise your hand. Okay. Mayor Ross, you recognize.
Thank you, Commissioner. I really agree with the encouraging people to wear masks in public and the idea and the spirit behind it. But I fall short when it comes to mandating this law. And this week, thank you, Ms. Snively, for your comments about public comment, because I don't know about the rest of you, but I've been blown up with phone calls and emails and everything else about this mask issue. And my concern about it being enacted in a law is a very specific point. One of them has to do with business owners. And one of the business owners that I talked to this week employs 70 people. And he said, I haven't had to lay off anybody. I've kept all 70 people on the payroll, even though our income is significantly decreased. But we've been doing it. And he goes, but I don't have 70 masks and I don't have the ability to buy 70 masks. And if this is the law, I can't allow these people to work anymore without these masks. And they're going to expect me to provide them for them. And I can't go home and make 70 masks for my employees out of old t-shirts. I have to be able to give them a commercial product and I can't get them. So my concern is that if we encourage people that go out when you have to go to the grocery store or the pharmacy to wear a mask, that's fine. I think if we put our energies behind public awareness campaigns or maybe a signage campaign to put outside the grocery stores or something, or those kinds of activities, I'm all in favor of that. But I'm reluctant to want to enact this in law because of the negative impact it's going to have on businesses that can't provide these masks. And they can't allow their workers to work. If it's in the law that they have to have a mask on, they have to have a mask on. And so I'm certainly in favor of encouragement. I'm in favor of a campaign, a public awareness campaign, things of those nature, but I'm not in favor of enacting a law to mandate that.
Commissioner Overman, you recognize.
Thank you, Chair. I do understand some concerns. It does put a burden on, typically would put a burden on the business owner. However, what we're not mandating is masks. In this particular order, it's defining it as a face covering, material that you can secure to someone's face in order to avoid spreading a virus. And whether if this gentleman, as an example, and I don't know what company you're talking about, but if this gentleman has 70 people working in a space and they're not able to at all times maintain a 6-foot distance, and they are not producing anything that would actually end up in someone's home, you know, that they might have basically contaminated and had delivered to their home. One of the things that face masks do is it prohibits the spread of the virus. It's a precautionary method to reduce the exposure. And while we heard earlier from Mayor Castor that comments have been made that it only protects, 50%, that's not as critically important as if you and I, or all of us, were talking to each other 6 foot apart, and we each had face mask covering, we would have a much greater chance of not getting this virus than if one of us had it on. And so I think it's critically important that we look at ways that people can act responsibly by protecting themselves and the people around them when they're in a public space, and especially if they're offering an essential service. So if there was going to be anything other than a recommendation or a guidance in place, I think it's critically important that we focus on those that are providing essential services. One, they need to feel safe. And two, they need to make sure that they're participating in minimizing any spread. And that was my concerns. I think it's very important for all of us to do that. So I'd like to make a motion, but I'm going to stick with the one we have now.
There's a motion on the floor already. Yes.
All right, I understand. Thank you.
Anyone else? Let me ask Ms. Beck a question. I'm sorry, Mayor Lott, you recognize. Mayor Lott, you recognize.
Thank you. I had my hand up, but I guess I had raised my real hand. But thank you for recognizing me, Mr. Chairman. The Vice Mayor and I here have to be on the same page here, is that I think all of us have a concern, a care. We're all, we've shown responsibility by putting the safer order in place. And I think that when we put that order in place, at that time we didn't have a rule book, we didn't have a benchmarks, we didn't have any data to be able to tell us what was the right decision or the wrong decision. But I thought we had the courage to put it in place, and I'm proud we did. I do feel, though, that if you look at the data that we are currently getting, even though it's fresh and young, and there's, obviously things we can probably argue about the data, I look at the end result as far as, the deaths that were occurring, okay? I think all of us thought there would be way, worse results than what we've experienced so far. I know our hearts and prayers go out to the families that have experienced this virus and death and so forth. But the data shows you that what we're doing right now, okay, is working, okay? And I think that if we allow us to have the time to continue to allow this data to work and the plan that we have in place to operate and to work, okay, we'll continue to see this data, okay, as we see it. I'm so happy that today, and I want to thank our chairman of the board, and I want to thank Mr. Merrill for bringing Mr. Richards forth. He's a great leader in our community. Our Plant City EDC works hand in hand with the Tampa Bay EDC, and we've had a lot of success together. I'm glad to see that we are now bringing into our meetings how are we going to restore our economy and put people back to work and restore the lives and the quality of life in our community. I'm not going to support this motion today, and the reason why is that if you look at what our citizens have done in abiding by the safer at home, I think that we gain more by education, encouraging, as the Vice Mayor said, recommending. But as soon as we start mandating, as soon as we start, making it shall versus should, okay, we start dividing our country, we start dividing our county, okay? And as soon as we start dividing our county, we start losing trust and faith as leaders in this group to lead our county back with the hope of restoring us back to where we were before this pandemic hit our county. So I really, believe that we've worked years in restoring trust in Hillsborough County. All of us have. And it was validated with the two last referendums for the tax on the school district and the tax on transportation throughout the county. And I believe that when we constantly bring orders forth, like we did Monday and like we're doing now, and make it a mandate or a shall, okay, then we start losing the citizens that have been working with us so well, okay, and helping us defeat this pandemic in our county. So I believe that we shouldn't have any order whatsoever. Okay. I tend to believe in the good of our citizens versus the bad. And I think if we go to them with recommendations without an order, it shouldn't be an order. It should be education, a recommendation. Just from the CDC, the CDC does recommend face masks, but it doesn't recommend a mandatory face mask. And so, I would encourage us, okay, to take a breath here, slow down for a second, and let's put some good information out to encourage the uses of a face mask, but please don't make it an order. Please don't make it a mandate. Thank you.
Mayor, let me ask a question first. I'm gonna call on you to close, Mayor. Let me ask a question, and then either Mayor, you can answer it, or Miss Beck, if you're still on the phone, can answer it. In the proposed order, it talks about face coverings and what should be a uniform face covering. But when it comes to the face covering required, it enumerates persons working or living or visiting or doing business in Hillsborough County should wear a face covering consistent with the CDC guidelines while working or visiting a grocery store, restaurant, pharmacy, public transit vehicles, vehicles for hire, or other locations in persons interaction occurs, but social distancing measures are not possible. So am I understanding that you can go without a face mask unless you do what Section 2A enumerates?
Yes.
My point is that I would recommend all those recommendations, but I don't believe we make a mandate. I don't believe we
Wait a minute. Wait. Well, two people are talking. Mayor, what did you say, Mayor?
I said, yes, that is true. It says if you can maintain the 6-foot distance separation, and the example given by Vice Mayor Lott of the company with 70 people, they should be able to mandate 6-foot separation, or they shouldn't be open unless they're providing healthcare services or some exception that goes in. And these things can be as simple as when you're coming in contact with someone, pulling your t-shirt up over your nose and your mouth. We're not making this, an onerous requirement here. It's very, very simple. And to the fact that Mayor Lott about the testing, we've tested 1% of our population. So we have no idea who has it and who doesn't have it out there. So to say that, let's just wait and see, that's a response that I've heard over and over and over with this virus. And it's really the last thing that we should do is wait and see. That's what happened in other cities like New York, and where Mayor de Blasio said the one thing that struck him from this virus is the swiftness with which it moved, that literally overnight the cases were going. So I think that it's a very simple step to take. I understand the encouragement, but that's what we're doing now. It's on Hillsborough County's website to encouraging it. The CDC can't mandate for the entire country. That's not their position. But if we do require this, then retailers will go from providing it if it's requested. If you look in some public stores statewide, it's mandated because there's an order from that community mandating that they wear it. And that's just simple protection for our community and for our citizens. And the city of Tampa has twice the density of Hillsborough County as well. So we've got people in very, very close proximity. I think it's the right thing to do. And I stand by it being an order and not a recommendation. And I don't feel that it's onerous at all. We've ordered masks for essential workers. We're in possession of those. I know the county has ordered masks for all of their essential workers. I think it's the right thing to do. Thank you, Chair.
Okay, well, I don't think I got my question asked, but that's okay.
Mr. Chair.
Mayor Lott, you recognize?
No, please go ahead. I'll speak in a minute.
Mr. Chair, this is Chad Chronister.
Yes, Sheriff, you recognize.
Thank you, sir. I would suggest that the group not create any other orders regarding personal restrictions. Make the mask usage a recommendation in accordance with the CDC guidelines. From a law enforcement position, requiring facial coverings makes law enforcement's job harder, even impossible, especially during times when we struggle and as it becomes even more challenging for us to provide our workforce, law enforcement, first responders workforce, with the proper personal protective equipment. So I too won't be supporting this motion. I would support a motion promoting a recommendation, but not requiring an order that would make law enforcement's job even more difficult, even impossible.
Thank you, Mayor. Sheriff. Mayor, let me say something to you. Remember what I told you about counting votes? Mayor?
Yeah, I heard you. It's the right
what I said
thing to
about
do.
counting
And
votes?
Sheriff Cronister, look at there's the exception in there for law enforcement. If you see read the last line on there.
But I told you about counting votes. I don't think you have the votes to pass this.
Well, I'll leave it up there and let everybody vote because I don't count votes. I just do what's right.
Okay, all right. Okay. Anyone else? Commissioner Oberman, you recognize.
Sorry, I'd like to offer an amendment to the motion.
What's your amendment?
My amendment is that we order essential service employers to ensure employees are wearing face coverings if they're not able to maintain the 6-foot social distancing from the public or coworkers. What we're seeing is grocery stores that are not providing face covering for the people in the store. Or as an example. And in that case, it's almost impossible for everyone in that store to maintain the 6-foot distancing. The list of organizations that are in the original orders guidelines do discuss those kinds of businesses, but it may not be clear. So I'd like to suggest move that we have an order that essential services employers ensure employees are wearing face covering if they cannot maintain the 6-foot social distancing from the public and coworkers. And all other persons would be strongly recommended that they wear face covering.
Is there a second to the amendment? Is there a second to the amendment? The amendment dies for lack of a second. We're now back on the main motion. Commissioner Merwin, you recognize.
Thank you very much. And if y'all recall, a week ago, I asked that we recommend the use of face masks back on the recommendation of Dr. Holt, and also what is going on nationally. I think one thing we do need to do is beef up our Joint Information Committee to maybe make it a stronger recommendation for people to wear face masks. I am not going to be able to support this motion today, mainly for the same reasons of the curfew. Facts drive decisions. We had 3 new cases today. Yesterday, we saw a little bit more than we've had, but generally they've been running about 30 new cases. I think this is one of those tools in the toolbox, just like the curfew. And if things start to peak, if they get to that point, then we have something to go back to keep our residents safe and help save lives. But I believe this is a huge burden on small business, and they are having to deal with so much right now. And we have the actions that we have taken have favorably impacted the number of new cases. I do believe that. And that's why I had those graphs. I was talked to staff and had the graphs brought in so we could understand and see the information before we make our decisions. I do believe our increases of new cases are declining in our county, and so should the conclusions that we make. And so I think if the reported rate of new cases does increase, like I've said before, it's appropriate to reconsider the use of face masks, but not today. We don't have, I think the facts are not there to support this decision. And that's why I cannot support this today going forward. Thank you.
Ms. Snively, recognized.
Thank you, Chair. I'll be brief as to not beat the dead horse here, but I do agree with pretty much everything that Mayor Lott said, and he really eloquently articulated many reasons why I also am not interested in supporting a mandate for face coverings or masks. You know, there's a reason why there's a state statute also that requires people not to wear those as well, with a lot of reasoning behind that state statute. But I just can't support it at this time, another mandate. However, as has been discussed, I certainly can support a strong recommendation for it and more education for it so that people understand the benefits of wearing a facial covering, how to make facial coverings, how to acquire them, and the proper usage of those facial coverings. So at this time, not able to support it, however, would definitely offer an amendment to support a recommendation for facial coverings for citizens of Hillsborough County.
Is that an amendment you're making?
Sure.
I don't think she wants to make an amendment.
I'll second that.
I think she wants to.
Wait a minute. Wait. The motion on the floor is for an order, Commissioner Merman. If she's going to make a recommendation, she has to make an amendment to the order motion. You follow me?
Oh, I thought she was making an amendment to the motion on the floor.
That's what she's doing. She's making an amendment to the motion on the floor to make a recommendation.
Correct.
Okay.
Okay. So
okay.
There's an amendment to make a recommendation from Ms. Snively. Is there a second?
I'll second.
Who was that?
Merman.
Mr. Merman seconds the amendment to the motion. Is there any discussion on the amendment to the motion to make it a recommendation? Any discussion on the amendment to, well,
Yeah,
Mr. Ross, hold up. Mayor Ross, you recognize. Mayor Ross?
Thank you, Commissioner. I just was going to ask, do we really need to have a motion to make a recommendation? Can we just put this information?
Pardon me?
Do we really need to pass an order to make a recommendation? Couldn't we just have the Joint Information Center?
Well, you're not passing an order to make a recommendation. You're just making it a recommendation. That's all. It's not an order to make a recommendation. Am I correct? Is that what we're saying?
I don't know. That's what I'm confused
Ms.
about.
Snively? Ms. Snively, unmute yourself.
Sorry about that. It really is just simply a recommendation. And so whether or not we actually need to pass, or I'm sorry, to vote on an actual order, I'll leave that up to the chair, but it is just
Let's do this. There's so much confusion going around now. I think we're making confusion out of confusion. Why don't we just, Ms. Snively, remove your amendment?
I will withdraw my friendly amendment.
All right, and we'll come back to you to discuss a recommendation because everybody's getting confused. We're now back on the motion by Mayor Castor, second by Commissioner Overman. Is there any further discussion on the motion?
Yeah.
Mayor, you recognize.
Thank you, sir. Just a couple of points. One, this has no effect whatsoever on our small businesses. So, the businesses that were considered essential were ones that could keep their individuals 6 feet from each other. So this would have no impact on small businesses. And if you read the number or the group, it simply is grocery stores, restaurants, pharmacies, public transit, vehicles for hire, and other locations where in-person interaction cannot be 6 foot apart. So it has nothing to do with small businesses. And Ms. Snively, the state statute dealing with masks has nothing to do with this. So that's a comparison of apples to oranges there. And again, with the rise in the cases, Literally, we've tested 1% of individuals. So I appreciate everybody's input, and I guess we'll just continue to recommend.
So do you want to vote on this, Mayor?
No, we can vote. I mean, it's going to be a no vote. Yeah, let's vote.
Okay. Let me say this. I strongly disagree that the numbers we see now, because they're so low, that's going to continue to go down. I mean, you just heard the experts say that our last week of April, the first week of May, the numbers are going to go up. And that means our hospital beds are going to be full.
Vice Mayor Ross, is it just me and you?
I can hear you. Everything froze on my screen.
Yeah, right now I'm only
Yeah,
seeing
the whole, this is Commissioner Overman. I'm on the phone and apparently that's working, but none of the internet connection is working because I'm actually on the phone and not on the
it
system.
looks like a blanket all the way through shutdown.
Yeah, everybody, all the video got killed. I think the only thing that's working is the phone. Because we're not hearing them come back. So everybody that was working through the video system
Fair enough.
isn't on the call.
Sounds good. Well, I'll be patient then and mute myself. Thank you.
Okay, same here.
I got a low bandwidth message. This is Tom Yunash, and I'm seeing video again. Maybe if people will just turn off their video feeds for a little while, we'll get people back on.
Everything looks normal here. We're stable here. I mean,
Yeah, there's no video to me. I'm here because I am on the phone as well.
James, do we have the ability to voice vote?
The Miller can't hear us. Everybody else is on their video microphones.